Hello and welcome, everybody. I'm Anthony Gonzalez, and I'm the Senior Program Coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to welcome you all today to our webinar titled From Screening to ScreenU, featuring our very own Logan Davis. Before we get started with today's content, I do just have a couple of housekeeping slides that I would like to share. On the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout the live session for our presenter. But please try to utilize the Q&A feature just so we can easily keep track of the questions. We do have the chat enabled, so feel free to introduce yourself and share where you're joining us from, as well as reflections and resources as it relates to today's content. But we kindly ask that you try to utilize the Q&A feature for any questions that you may have. Additionally, if you would like to enable captioning for today's session, you should be able to do that through your bottom dashboard. If you have any trouble getting that set up, just send me a chat and I will help you through that process. We'd also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. We also have a few upcoming events I'd like to share with everybody. Our next water cooler chat will be taking place on June 11th, and we'll be focusing around the topic of problem gambling. Our next free webinar will be taking place on June 17th, and we'll be launching that registration probably early next week, and we'll be featuring our very own Dr. Jim Lang, and that topic will be on the introduction to prevention, considering comprehensive approaches. And of course, we have the 2024 national meeting taking place here in Columbus at the end of July and the beginning of August. We will be also offering a simultaneous virtual conference offering for those who can't join us in person in Ohio. And with that, it is my great pleasure to turn it over to my colleague and good friend, Logan Davis. Logan is our Outreach and Engagement Manager here with the center. Thanks for joining us, Logan, and it's my pleasure turning it over to you at this time.
Awesome. Thanks so much, Anthony. And I wanted to change that slide from that super formal picture as quickly as possible. No, but just wanted to, as we start, just thank you so much for being here today. And thank you so much for your ongoing support of the Higher Ed Center. I recognize so many names as I'm looking through the participant tab. And just so thank you so much for being here. My hope is to make this as informative as possible, and knowing it is more informative conversation, trying to include some engaging pieces as well. And so I'm going to talk a little bit about me and how I approach my work, and thinking about the words that you see on the screen, the words I use to describe myself. But I would love to know who is with us today. And so if you don't mind introducing yourself, letting us know just who you are, what you do, where you do it at, and if you're comfortable, what is one word, maybe two words that you would use to describe yourself? You don't have to describe them. You can leave it open to interpretation, if you will, but would love to know who is with us today, and get you to thinking a little bit about yourself, a little introspection of what makes you you, and some of the words that you use to describe yourself. And so for me, a couple of words that I want to point out. First one we're going to be is Dad. Obviously, you see on the screen, and we'll show pictures of him in a minute. He's cute, so why not use him as content, right? But for me, not just because I have a cute kid, but because being a parent changed the way that I viewed the world. For those of you that are parents on the call, we know that changes the way that we do the work that we do, just the way we approach the work. And so for me, especially in the world of prevention, also thinking about safety, definitely impacts the work that I do. And the last one that I want to point out is Southerner, not because I'm going to try to hide my Southern drawl for the next 55 minutes, but because I grew up in a very rural Southern Baptist conservative area. And so for me, that obviously shaped my upbringing. It shaped my experiences and interactions with alcohol in college. And being someone who was never around alcohol growing up, and then in a college environment where, especially joining a fraternity where it was very, very present and prevalent. And now not exactly aspiring or practicing some of the things that I was taught growing up, definitely makes me think about just the world around me, and it makes me think about the work that I do, and it reminds me to remember that students are who they are because of the environments that they have been a part of, and they bring that with them. And then so we need to think about that in the work that we do. And then so that is me. If you have any questions about me or about the work we do at the center, please feel free to put those in the Q&A. Happy to answer those as well. And then so I talked a little bit about me, and then so do want to talk about the great things in my life. I have the opportunity to parent these two wildlings. Toby is the original. He is a 12-year-old Maltese Shih Tzu. And I think he's been bathing and sunbathing outside for about an hour now. And this is a 1-year-old King Charles Cavalier. This is Titus. They keep us on our toes. That is for sure. Also have the opportunity to parent this guy. He is no longer that small, but he is pretty cute. We're down to like single digits in the days left in kindergarten, so hard to believe it's already been a year till we finish that. But he's pretty cool and love to show him off when I can. Awesome. So we're gonna get going. Just want to let you know what to expect for the next few moments as we talk about from screening to ScreenU. So we're going to talk a little bit about laying the foundation and how we're going to approach the next two conversations around screening with that broad overview of screening, and then we'll talk about the conversation from screening to ScreenU. So as we talk about laying the foundation, and the reason I want to start here is some of it is because like foundational conversations or thinking about basic conversations have been racking my brain for the last several weeks. So thinking about whether it be basic needs of students, that was our conversation we had earlier this week for the May water cooler chat. And then so if we think about the word base, it also is connected to foundation. So if we think about basic, we often think about basic in terms of simple. Simple isn't always necessarily a bad thing. Foundational things are key. I often see on social media people talking about buying a home, that one of the looking at the foundation is often overlooked. And so if we think about those foundational pieces, they're key. We have to go back to them as often as possible, even though they may seem simple. And then so that is why I want to approach today's conversation about foundation. And so with that, we're going to think about supporting questions. And so we're going to use each of these questions in those two areas. So looking at screening from a broad overview, and then looking about from screening to ScreenU. And then so we're looking at the questions, the basic ones, right? Who, what, when, where, why, and how. And then so laying that foundation so we have a true understanding of what screening is, why it is a foundational tool in our work, and then also thinking about a broad understanding of ScreenU and then how it is a foundational tool of screening. And again, don't hesitate to put questions in the Q&A. I will try to keep an eye on the Q&A as we go through. So if there is a timely question, I will try to get to that. If not, definitely we'll answer questions at the end. And so I want to start out with a conversation around screening. And sometimes screening can seem a little bit novel because we often think about it from our work perspective, right? So we think about it in a public health or a health setting, that's really all it is. When I want to demystify screening just a little bit, because I think there is so much to screening that we often don't think about. We do screening all the time, whether it's we go to the grocery store and we're picking out fruit, right? We're screening our fruit. If we're looking at strawberries, we're looking for bruises. We're screening them for abnormalities, if you will. We're looking for feedback on the strawberries to say whether these are going to be good to eat, whether they look more red than more green. Are we looking for green so they will ripen? Or we're looking at peaches, for example. Are they soft already, or do we need to set them in the windowsill a little bit so they're perfect to eat in just a couple days? Are we looking at a watermelon? So looking at all the sides. Something that for us, this seems like a daily function. It's screening. That's exactly what we do. Something else, and this one may get a few giggles. It may not be the best example, but it's something that we do is dating. Dating is screening. We're looking for abnormalities. We're looking for red flags or risk factors, if you will, from what we want to experience out of said relationship. So in those conversations that we're having, in those experiences that we're having, we are screening for feedback, looking for feedback from ourselves. Is this something that I enjoy? Is this something that is supportive or is good for me? Another example for those of you that are over 30 on the conversation that happens regularly when you look in the mirror thinking about hair. You're screening your hair for gray hairs and seeing, okay, how many more of them? And to a point, you're screening so you can remove them. And then you get to a point you're screening to see how they are taking over. That's exactly what it is. It seems like you're just taking care of yourself, but really you're just screening to see what is or hasn't been there before. It's an abnormality. It is a red flag, if you will. Another one that we think about, this is the last one, so we talk more about kind of the public health and the health space, is buying a car, right? So we're thinking about what are those things we want? What is that feedback that we need? And then so we may be looking at the first car. It's like, oh yeah, I really like this one. This is great, but does it meet the needs that we have? No, okay, we move on to the next car. And looks like it might be a little more safe, but does it meet the needs? Does it have the storage that we need? Let's say if you have a family. And then you get into the other, it's not as sporty, may not be as fun or exciting or inviting as the other one, but it meets all of your needs. So screening to see exactly what you are looking for. And oftentimes when we think about screening, we're looking for specific things, right? We're looking for that checklist. We're looking for those risk factors, for those red flags. And so if we think about in a health or a medical sense, we're often screening for diseases. We're screening for early detection of risk factors or warning signs to say, hey, we need to look at this further. And that's the exact same thing that we do in public health, whether it would be screening for mental health, which things such as the PHQ-9, I forget the letters in there in 7. So you have your depression screening and your anxiety screening. And then so you're looking about behavior and you're looking at baseline. Is behavior different? What are those risk factors? What are those red flags to know, okay, we need to do something about this. We're screening to know what we need to do based on the information or the feedback that we receive. So that is broad scope on screening. And so we think about what screening is. We're going to talk about screening specifically from kind of the gold standard of screening in terms of SBIRT. And then so when we think about SBIRT, and I was going to have you guess each of the ones. I guess I'm going to give you number one for free. Is so if we think about SBIRT, it is an acronym, and I would love to see if you can play along with me here. Is so what would we guess of is so after screening, those of you that already know it, it's a give me here. What is the second word in SBIRT? So we have screening. What would that B stand for? In the chat is perfect. Brief, Tim, gold star to you. It is on the way. So brief, screening, brief. Oh, and I can give you the intervention as well. So brief intervention. And then what about the R, folks? What do we think the R would stand for? Kathy is on it. Referral to treatment. So boom, screening, brief intervention, and referral to treatment. So it is typically our gold standard when we think about screening in the public health space. And so we'll talk about what exactly screening is. I would love in the chat, if you are utilizing SBIRT, I would love to hear about if you're using it, how you're utilizing SBIRT, whether it's in a web-based or virtual way, or if you're using in-person SBIRT on campus. Because as we'll see, it is the gold standard. It is recommended for higher education spaces. And if you're using ScreenU, you will save that because we'll talk about ScreenU being a web-based version of SBIRT. So about what is SBIRT? And then so we think about what is it? It is a tool, so screening, brief intervention. And so what it does is it quickly assesses the severity of use. And so it's getting that feedback, it's screening about use, asking those questions about what is happening. And then so focuses on increasing insight and awareness, right? So giving people insight into what their behaviors are. So they're answering the questions, but it's a little bit introspective. So they can see, oh, okay, I didn't realize that this was happening. I didn't realize that like, let's say if it's the PHQ-9, for example, which is the depression screening, which would be asking, like, how often do you feel down or depressed? And it's like, oh, I didn't realize I was feeling it that often. And then so, or how often for the anxiety screening is how often do you feel nervous or on edge or worried? And then so answering that question at the end, you can see your answer or your response. And it's like, oh, I didn't necessarily know. So it gives you that introspection and that insight and awareness of what your behaviors actually are. and it provides appropriate resources and care. And so that is the end, that referral to treatment piece. And so providing resources. So for what someone is experiencing, if they need some type of care, some type of support, we can then point them in that right direction or make that warm handoff and then say, hey, had this conversation with this person. This is what they're experiencing. And they would love to learn more about how to potentially follow up with that. And lastly, wanting to know about SBIRT is that it's an early intervention approach, and the goal is to prevent more severe consequences from occurring. And so I think this is important to point out is it can change behavior, but what we know what the research has shown is that it prevents more severe consequences. And so we're looking in that middle range. So how do we keep people in that middle, that moderate risk for any type of risk? So whether it be mental health, whether it be substance use, and then so how do we keep them in that middle? And then how do we potentially lower them into that so we don't increase that risk and they don't experience severe consequences? And then so want to just walk through the key components. It's going to very much follow the name. So with screening, brief intervention, or referral to treatment, but first is brief. One of the keys is it's going to take around 10 minutes or less. They're going to take the screening. Then you're going to go through their results with them, provide them their feedback, and then walk through a brief intervention if necessary. So if there is any risk present, and then so walk through that. And then provide them resources or then referral to treatment if necessary. So something that doesn't take a whole lot of time, so less than 10 minutes. And then so another positive is that it's universal. So it doesn't mean a person has to have a prerequisite, if you will, before they can then go through SBIRT. You can screen anyone and everyone. So for example, I think Tim said they use it in their clinic. So it doesn't like, okay, we're only doing people that identify with this. Every single person that comes through will take the screening, go through the brief intervention if necessary, and then provide resources. So it can be universally applied wherever. It doesn't just have to be in treatment settings. It can happen anytime there is an opportunity to have a one-on-one conversation. And I already mentioned that one. I'm ahead of myself. And then it utilizes motivational interviewing. I've already used the term gold standard quite often, but we know that MI is effective and people in our space already utilize it very well and effectively. And then so it is something that we know works with our audience, especially our target audience and that moderate risk range. And then so that is the key positive of doing that. So MI, big plus to that. So why SBIRT? And then so some of the things that we know with SBIRT, and then to point out first, the majority of the research around SBIRT has been done with alcohol. We do know and are seeing more research around SBIRT with other substances and other issues is increasing, but majority of the research is around alcohol. And then so with alcohol, SBIRT has been shown from the research to reduce typical BAC and peak BAC, that peak number of drinks, those average number of drinks per week, that number of drunk episodes that goes with that average number of drinks, and just an overall reduction in substance misuse. And then with the growing research, we have seen that it is including cannabis frequency. So for those that are going through SBIRT talking about cannabis, we see that it's including cannabis frequency in that reduction as well. And along with upcoming research, sorry, I was trying to think of a better word than upcoming. I couldn't think of it. And then I'm sure it's going to hit me halfway through the next conversation and you'll see a light bulb go off. And I may share that word with you when it comes to me. But when that upcoming research, we are seeing a lot of research on web-based versions of SBIRT, and they are very supportive of that. So they're very showing positive correlations with SBIRT being used in a virtual web-based space. So we have seen SBIRT be supported very broadly in the US as well as internationally by the World Health Organization and by SAMHSA. SAMHSA is a huge proponent. They have its own workbook on SBIRT. While it is typically aimed at the community setting and can be very valuable. So if you just Google SAMHSA and SBIRT, and then we know it is also endorsed and supported by the American Medical Association. and the U.S. Preventative Services Task Force. It has also been mentioned specifically in the last two drug control strategies documents by the last two administrations. And then so the current administration has screening everywhere in the document. Like if you Google screening, it's almost every other page. And then so screening is a huge aspect of the strategy of the current administration. And I think it will continue if the opportunity is given there. The previous administration named SBIRT outright for higher education settings. And then so it has been supported by the administration of the US government the last two times. So now we know what it is, what is happening, what happens within it, why it is considered a gold standard strategy, how it works. For my flowchart people, this is for you. I am one of you, so welcome. And then so if we're thinking about step by step, how is it going? They go in for the screening, quickly assess what is going on in severity of use or the issue or problem that is happening. If there is no risk or no kind of those red flags or abnormalities that we talked about earlier, we have that happening here. If there is, ask further questions about that. So go through feedback, talking about that feedback, going through that, and then looking at high risk use, going through that brief intervention, right? And then so thinking about in the brief intervention, they're using common conversations around change behavior. So thinking about why are you doing this? What are your thoughts around change? Would you be confident in your ability to change if you needed to? Do you think you are ready to change right now? Things of that nature. And if there is a severe use, it's skipping that brief intervention. This is the in-person setting and going directly to that referral to treatment. Because if somebody is severe use, the intervention isn't going to be necessary at that point, and they need more extensive treatment. So then we move in to where, and I would love to hear in the chat, and I will say this is a little bit of a trick question. So think about it as broadly as you want. Don't feel free to answer as much. Where would it make sense to utilize SBIRT on campus? Give it a minute for responses to come in. Medical services, absolutely. Thank you, Kathy. Spirit of silence and time. We'll keep going. Student health, student affairs, counseling services, academic advising. Absolutely, Renee. Here they're coming. And then so yeah, any student office, absolutely. And I love the any piece, Chioma, because what I meant by a trick question is everywhere. There's nowhere that SBIRT can't be used. If we think about, like I said, if there's an opportunity for that one-on-one conversation, SBIRT can be used in that setting. So we think academic advising, we think counseling, we think student conduct, we think if there's LGBTQ services, if there are specific race-based or ethnicity-based centers. So anytime there is an opportunity for that specific one-on-one meeting and conversation, it absolutely can be used. And if you have the opportunity to invite Buddy, I'll get it, Woody and Buzz with you, why wouldn't you? So if we think about who, right, other than everyone, so one key component of SBIRT that we talked about was that universal. So when we're thinking about it, we touched on this briefly, is what is our target audience? We know it is that risky use piece, right? Because we talked about that it has been shown to reduce peak BAC, the number of drinks in one sitting, the number of drinks per week, the number of drunk episodes. And so if we're thinking about this risky use, how do we prevent those in this middle column of our pyramid from experiencing those severe consequences or moving in the direction of a substance use disorder or increasing their symptoms of a substance use disorder? So how do we keep them here? Or how do we move them into that low or no risk? So if someone is experiencing a few consequences, how do we lessen the number of consequences they're experiencing? And so they're at low risk. And so they're not experiencing as high a risk as they were, and that makes them into a low risk category. And then so we're specifically focusing on those risky students. And so while this doesn't mean we can't screen every single student, if we have the opportunity to do that, absolutely. But if we're thinking about target audiences, we know the ones that are experiencing use. And then so we'll talk about in ScreenU, fraternity and sorority in the last 3 years has been a huge target audience and been seeing great successes in that because we know they're a risky population. So how do we lower those risks and keep them from experiencing more severe consequences? So if we think about in-person SBIRT, some challenges do happen. While it is a gold standard, it is recommended by the ONDCP, by all of these associations and organizations, we do know there are some challenges. And then so it requires training. And then oftentimes training often comes with requirements of funding, which we know in our world of higher education is ever fleeting. And then so it also time, right? So when do we find the time to get the training? Do we have the people to be trained? How long are we going to be able to retain those people that have been trained? And it can be time intensive. While each one is quick, it's only 1-to-1, right? So if we're thinking about screening 20 students a day, that's almost a half a day, if not more, thinking about just doing SBIRT, not going to be everything else that we have happening in our job or all of the requirements that we have in our role. And then so for 1-to-1, we know it can be time intensive if we're truly trying to do universal screening. And that going with that can be hard to implement on that large scale, right? Because how do we make sure we're training the right people? How do we make sure we're getting all of these steps in place to move in a direction where we want to do large scale universal screening? And oftentimes it includes manual data tracking. So having that conversation with the student, tracking that in there and making sure that all of those conversations that are happening across campus get into one universal document or data source. So transition just a little bit, moving from screening generally to SBIRT to ScreenU. I want to pause and just let people know that feel free to submit those questions. This also gives me a chance to check on questions. And so if you have questions, please feel free to put those in now. And I'm going to be watching as we start going into this next section. If they are relevant, we will stop and go through those questions if needed. So back to those foundational and supportive questions. So we're thinking about ScreenU specifically. So what is ScreenU? So at its core, ScreenU is a web-based tool that identifies students who are at risk for alcohol, cannabis, or prescription drug problems. It is a web-based version of SBIRT. And so we'll look at the why category or the how it works in just a minute, another little flow chart there. And so it walks students through step by step. A student takes the screening, they get immediate feedback. They go through that brief intervention. It's a series of open-ended and scale-based questions, which we'll see here in just a moment. And then it gives students resources that are available on campus. So that is that referral to treatment piece. And those resources can be customized to the campus and the community. So the practitioner will then put those in on the back end. So students will see resources that are specific to that. And also what ScreenU is and what it does. And then so what we've seen from or heard from our members and they've seen from their students is that students are preferring to take this on their own personal device. And why this works, as you can see on the screen, is it adapts to any type of a device. So whether that's an iPhone or an Android phone or a Google phone, and then so it's going to be able to adapt. And so it's going to look fresh and clean on that screen, whether that is a computer, a phone, a tablet, or a desktop computer as well. And so that adjusts to that. So how it works. And so this is the flow chart that I was mentioning. And then so just to pause for a moment. So if we're talking about SBIRT, we talked about those screening tools. Some of them we can use. So ScreenU has tools for alcohol, cannabis, and prescription drugs. And then so for those screenings for alcohol, we use the alcohol use disorder identification test from the World Health Organization. For cannabis, we use the QDIT-R, which is the cannabis use disorder identification test revised, also from the World Health Organization. And for prescription drug, we use an in-house tool that we created in concert with the College of Pharmacy here at Ohio State. And then so a student takes the screening, boom, and they get their feedback based on their risk level. And so as, for example, it'd say your behavior shows you at a moderate risk. Here's what that means. We'll look at an example of that in just a moment. And then so after going through that, they start that motivational interviewing piece. They go through the resources and then done. And then so as we're going through, and then what we're seeing here from screening to resources from beginning to end, we're seeing an average of 10 minutes for all three tools, alcohol, cannabis, and prescription drug from beginning to completion. So still having that brief piece. So before diving into the student experience, I saw a great question come in. And then so what do we do with screening for cocaine use? I think that is a really great question. And then so I think why we don't necessarily see screeners for drugs like that is because while using those, it's extremely high risk. And then so, but if there is an available and tool that has been assessed and we know it is effective, but it could be used in an SBIRT type way as well. So have the student take the screening, talk about what their risks are with use, right? So we know with the use of cocaine, especially if we're thinking about in the drug environment and that we're in currently with the presence of fentanyl. And then so thinking about that conversation, going through the brief intervention, and then looking at resources or referral to treatment. And so unfortunately not available specifically to ScreenU, but if there is a tool available, I'm currently not aware of one, but if there is one available that has been assessed and evaluated, you could use it in that SBIRT process. So let's dive in now into the student process. If you would like to play around, whether it be on your phone while we're going through, whether it's on your browser, if you have a second screen, please feel free to do this. And then so this will take you to a landing page that has links to all three of the programs. And so Anthony, or I got it right here, I think, maybe. No. Anthony, if you could put that link, I would really, really appreciate it. I'm not able to copy and paste, sorry. And then so we had a great question come in about the time. And then so it's 10 minutes for each one individually. So if they're taking all three consecutively, that would be a little under 30 minutes. We do see it takes a little bit longer for students to complete alcohol, because we know more of our students are using the substance than we do see with cannabis and prescription drug. And so each individual tool is 10 minutes or less. And so feel free to take these screenings as many times as you need. So if you want to see what it would look like to answer, no, you don't use the substance, or go through and answer on the high end to every question, feel free to take those. And this can be used ongoing. So it doesn't it doesn't expire today. So feel free to keep this link and you can test out. This will be the student-facing side of the tool. And Anthony posted that link in the chat. Thank you so much for doing that, Anthony. Kudos to Anthony. He is a rock star. So as you'll notice, if you're playing around with the tool, it is deployed through what we call campaigns, which can be a little confusing, but really all it is a link. So ScreenU, the back end, you create the opportunity, and then it gives you a link, and then that link can be used to create a QR code, like you saw on the previous slide. You can create a shortened link, or you can send that link just directly in emails. You can use it in slides. And then so what we see is then we have the student clicks on it. They click on the link. There's no login required for the student. They just need to have access to that link. There is a way in the tool, and if you're interested in learning more, we could talk about it in a more in-depth demo, but there is a way to track completion. And so ScreenU itself is an anonymous tool, so you're not able to see the individual responses of the student, but you are able to, or individual risk levels, but you can see whether a student utilizing a specific tool. If you input an email address, you can see their completion, yes or no. And then so as we walk through the student-facing side, this is the first thing students see. So we have this welcome message. This message is customizable, so you can make it specific to your campus if needed, if you needed to add in specific things that are university requirements. And then we have our demographic questions, which we have is gender identity, and do you identify as a member of the trans community or transgender? And then we have class rank and age. And then so here are the breakdowns of those options. The gender options were edited and rolled out at the beginning of January. So these are brand new. And then so this made it a two-part question. So adding to the number of options that we had in the gender identity question, and then giving the students the option to identify as part of the trans community if they wanted to. And then class rank is from first year all the way to graduate doctoral. And then age that you saw that last one is self-input. So the screening after the demographics all start like this. So this is the one for alcohol. And so they start with a gateway question with the substance defined at the top that you see here. And then have you used the substance in the last period of time? And then so the audit uses 12 months. So that alcohol use disorder identification test. The QDIT, which is cannabis, uses 6 months. And then we use 6 months for the prescription drug tool as well. So have you used the substance in the set amount of time? If a student selects no, the screening is over. And then so they're going to get resources, positive reinforcement about their decision not to use, and then the screening will be over. If a student selects that they are in recovery, the screening is also going to be over, but they're going to get recovery specific resources. So you have the opportunity on the back end to add those resources that are specific to recovery. And this is what those resources will look like. And then so if they answer yes, they're going to go through the screening. And this is what these questions will look like. And it will go through each of those questions that are in the screening tool. And then so as they click through that, and again, we mentioned that it is adaptable to any type of device. So if we're looking at a phone, for example, it would look like this. So a little bit of a different layout, but still very clean and fresh. So a student goes through the screening, they answer all of those questions, they get their risk level. So at the top, answer what this means. So based on their responses, indicate a high or a moderate risk. And then so here's some examples of that behavior that you may be doing or partaking in. So drinking to get drunk. And these are adaptable may not be the right word, are specific to the risk level. So if a student is at a moderate risk, these are going to look different. They're going to be specific to the risk level that we get. And even if we're going to get high risk, likely dependent, or high risk, what is it? I think it's the highest risk level. The specific language is escaping me, but the highest risk level is the language is going to be even different there as well. And as we continue on the feedback page, we're going to see what is happening to the body. So some of the effects of high drinking. So thinking about judgment. And then we're thinking about some of the risk. What are some of those severe consequences that they continue this behavior they might experience? So as they wrap up that feedback, they go into the brief intervention. As I mentioned, it is a series of open-ended and scale-based questions. So it's questions like this. What are some reasons you thought about changing or drinking? This specific question, we see students answer in a way with two themes, whether it be around health or finances. It's typically where we see students land here. They'll have a follow-up question to that. And then they go into scale-based questions around importance, confidence, and readiness for change. So how important do you feel it is for you to change? How confident are you in your ability to change? And how ready do you feel you are to make a change? And how they answer on the scale depends on the open-ended question and the number of open-ended questions that they get. Like, for example, if we answer an 8 on this importance question, and so it sounds like it's pretty important to you, who's been supportive of you in the past? How can they help? So utilizing those motivational interviewing strategies, so the things that you as a practitioner would probably do in an individual one-on-one in-person setting, but it happens automatically through the algorithm. And as soon as they finish that brief interaction, so answering that last question, they get their resource page. And their risk level is going to be reiterated at the top here. So we see a lot of counseling or student conduct saying, we would like to know what their risk level is. Because of an anonymous tool, there is no way to see individual responses on the back end, but you can have students save this. There is an opportunity for them to save it as a PDF. They can also email that PDF directly to them as well. And so by knowing what their risk level is, then you can have those conversations about what do they think, what do they feel about, or do they agree? Does their risk level, how does their behavior contribute to that, so on and so forth. And then we see the resources, listed here. One important note on resources, adding resources is super simple. It can be a little cumbersome. We want to make sure we have as many resources as possible, but the name that resources are given when they are added is what shows up for the student on their resource page. And then so if it's specific to the campus, like it has a name or using the school name or the mascot name, for example, that would be there so if the student can recognize like, oh, this is specific to me and not a generality. And we also have these risk and protective factors here. So there's some behaviors that they can keep in mind. And then additional resources populate ongoing as you go down through the resource page. And then so can be specific to recovery. If you have a recovery ally, you can include, and also if you have support groups that can be listed there as well. And then the last thing students see is this thank you message. This message is also customizable. And here's where students can download that PDF. There also is a certificate of completion that does have a date stamp, and it does have a unique identifier code as well. Pause for just a moment and invite questions on the student-based experience. And it's only gonna take us a quick second to get through the admin experience. And so if there are questions, we'll take those as we get through this admin experience. So if we're looking at the backside that you as an admin would see, this is what that page would look like. This is what we call our dashboard. We have our menu that we will navigate anything and everything through on the left-hand side. So our left-hand toolbar, and this will help us navigate all of that. And then we can manage our account in the top right-hand screen. So I mentioned previously that the program has the 3 programs. And so we see alcohol, prescription drug, and marijuana. So you can get reports based on this. So while we don't get individual data, we do get fantastic aggregate data that we can see. And then so there is a way to look at reports in a variety of views. And so there is so if we'll go back just a second, if we see it on the left-hand toolbar, we do see reports. And then so that is where we're going to get to this campus report. This is going to give us every single campaign or link that we have created will populate in here. And let's say we've been using the program for 5 years. If we leave this date range blank, the start and end date blank, then we are going to see the entirety that we have been using the tool. And so if we can also put in, let's say we just want to look at this academic term that we just completed, we could put in today and then put in January 1 or whatever the specific start date was for the student. So you can hone in on specific dates if you would like to. There also is a way to look at reports based on specific campaigns. So let's say you did a campaign in student orientation, for example, you would be able to pull that specific campaign. The campaigns, whether it's a campus report or a campaign report, the layout is the same. The data is just going to be a little bit different. So we'll walk through what some of the data that you get is. Apologies, 1 second. I stole my wife's keys. I want to make sure she knows where to get it. I think they're, welcome back. So sorry about that. Great question, Jacqueline. And so I will highlight the cost of ScreenU. I'll go ahead and mention it briefly in case people have to leave. But access to all 3 programs is $2,500. Access to individual programs is $1,000 each. And so that is includes the access to ScreenU, but it also includes other membership options. So access to the member portal, access to learning collaboratives. And so at the highest level of membership, that's that campus membership, you get access to all 3 ScreenU programs and then the rest of the higher ed membership as well. Great question. Thank you. Okay, and then so as we see overall risk level, so we get a breakdown of this, and this is where I always sound like a huge nerd when I talk about our campus reports. This particular pie chart is very, very cool, and then so it can open up and then break down additional info. So if we were to click on this pink piece, this high risk, likely dependent, or if a salmon, if you're color specific, and then so it is going to break down similar to what we'll see on this page. And so we get a breakdown of demographic responses as well. So we would get a breakdown of students that we saw answered in that specific way. However, on this specific pie chart, we also then, before we get the demographic pieces, we additionally get the scale-based responses. So if for students that were at high risk, likely dependent, we are able to see how they answered in their importance, confidence, and readiness for change. Okay, so that is then report. So only thing to highlight here is that we every single question in the screening tool gets its own pie chart. So we just threw a lot of information. So we're gonna have a break with cute dog and child pics. And then so I may have put you to sleep. You may be a little confused or just like I'm trying to understand, or you might be like Avit and you're like super pumped. I'm really, really excited. If not, it doesn't matter. I'm just really glad you're here and learning more about ScreenU and spending your time with us this afternoon. And I get you to show pictures of my cute dogs and cute kids. So thinking about why utilize ScreenU? What are some of the benefits? And then so as we talk through it, I've mentioned these, but specifically drawing them out, we know that it is web-based. And then so it pulls out that concern about that timing, that one-to-one, having people, and it is an anonymous screening tool. And so students can answer in a way that they feel comfortable and safe in doing so. It continues that brief component. And so we see that again, 10 minutes or less. And then we see it doesn't require training to implement, connect students with vital resources. It has real-time reporting, customizable elements, and then lastly, it has programs for alcohol, cannabis, and prescription drug. And then so saw a question come in about ScreenU using campaigns. And so for those of you that were able to access the link that Anthony put in there, that landing page, and then so what you see, those links for each of the ScreenU alcohol, those are typical, those are actually what we've created on the back end in our account as a campaign. So we probably titled it ScreenU Demo Campaign. And then so as you take that link, as you take that screening using that link, it is then going to populate data for that specific campaign. And then so let's say, for example, in ScreenU alcohol, we were to create another campaign that would give us a separate link. So for example, I'll use the University of South Carolina. They have been a fantastic partner working in their fraternity and sorority community, utilizing ScreenU. So when they create a campaign, they're going to create one specific for that chapter for that academic term. And then so they're going to have they're going to have a specific campaign for chapter A, and then they'll have one for chapter B. And then so the link would be different each and every time. Hope that helps explain. Can go into a little more detail if it's still confusing. So some other reasons about why the utilization of ScreenU. We know we have the ability to reach a broader audience, and it can increase the number of students screened, right? So we don't have to rely on the students necessarily coming to us. For that, we can go to them, and with that link that we have by creating the campaign, we can put it in front of them immediately, whether it's in an audience that we go to them at, or we could put it in their email inbox or put it around campus where they would see it, or at a tabling event, which we have seen some of our members do as well. We get easy access to downloadable data. And so we've seen the report that is automatically generated, but we also have access to a raw data file. The cool pieces of that is that we are able to see the open-ended responses. And then so a cool opportunity there. We have seen, again, at the University of South Carolina, they partnered with some of their public health students in the graduate program, and they used that data for a class project and were able to meet an academic requirement and provide some really cool data analysis back to the SAPE office at the University of South Carolina. And it can easily involve multiple departments on campus, which gets us to the where and a little bit of who. So where can it be used and who can utilize the tool? And then so these are just a few of the offices or departments that can utilize ScreenU on campus. So we think student wellness, health promotion, athletics, fraternity and sorority life. And I pick on fraternity and sorority life. I forgot to mention this in my introduction. My background into higher education is advising fraternities and sororities. And so I identify us as a high-risk population. And I pick on them and use them as an example a lot because that is my fraternal experience. That is my professional experience. We also see in student health services, academic advising, outreach, residence life, student conduct. This is just an example of what could be done. I don't think necessarily there is a place that can't be used. And so this is just what we've seen often used as well. And then so what are some of the positives in doing that? It can be utilized throughout the year. So it doesn't necessarily have to be used at high risk times. It can be used routinely throughout the year. And then so if we're thinking about if we go in, so if we're thinking our responsibilities, if we go in and do presentations, how can we utilize ScreenU with that? Can we put the QR code on at the beginning as students are coming in? And then maybe before we wrap up, showing them the results, and then maybe doing some norming with that if you have other data. And then so talking about, are you surprised that we have this? And so when we see the presentations with Fraternity Sorority Life, that's what often happens. They take it at the very beginning. They walk through those results in real time. Academic advising presentations, so whether that's with a large group or one-on-one, having the students take that before. So if you're emailing students to take to set up meetings, maybe include that link in there. If we see athlete orientation, we have a quote from a coach that said, how cool is it that we can provide this opportunity to students, and then because our students are coming from all over the world, and then they have a list of resources that are available on campus. So brand new environment, and they have some of the key things that they need to thrive while they are on campus. So how do we make it happen on campus? The key is having that champion, so that one partner who really believes in it, and they are that driving force. So think about other programs that you have on campus. Who is that person that is behind it, that believes in it, and is willing to get people on board? The driver of the bus, that you will, the rally person, gaining buy-in, highlighting the benefits, and is willing to send out those emails saying, this is what is happening. So we're running out of time, and so I'm going to speed through these kind of quickly. And then so if we're thinking wellness and health promotion, we're thinking wellness presentations, hyperlinks on our website, pop-up and tabling events, 21st birthday messaging, passive messaging, and social media. And again, these are in your slides as well. So if we think about athletics, again, we've already mentioned this, but athlete orientation, we're thinking about if there's a beginning of the year email, welcome. Here's this really great tool that we have. Again, academic advising. If you're doing team presentations, so if you have the opportunity for maybe a wrap-up meeting with basketball, if basketball's they've wrapped up for the year or before the season starts for a team. So how do you get the opportunity to do that? If we have preseason and postseason screenings, this is the big one for me. I think would be a huge opportunity because we do know data shows that use changes in season and off season for our students. So how do we give them that feedback before they start and after they end to remind themselves of how do they avoid some of those severe consequences? In conduct, kind of that triage. So if they have a minor infraction, ScreenU is often used as what we see with our members there. Clinical settings we see in waiting rooms. And then we see you could have a tablet or they would receive, they have a QR code there they could scan in and take it. So a great question come in about a price, that 2,500, yes, unlimited number of campaigns. So you're not limited to a certain number of screenings that you can have students take. You can create an unlimited number of campaigns. Our goal would be to screen as many students as possible, all of them. That would be absolutely amazing. So there is no limit for you in the utilization of the tool. So if we think how to make it happen, we know it's going to look different on every campus. And then, so what are some available resources from the center? So myself is available. We have other members of our staff that can do this as well if I'm out, for example. And so we can help you set up. We can have walk through the tool kind of like a demo, but thinking about how do we want to use this? So we create a campaign. What are some ways we can utilize a campaign? Fraternity and sorority, athletics, working maybe with our Black Student Center, our Cultural Day Center, LGBTQ Center. So what are some of those brainstorming ways that we can make things happen? And then if monthly TH sessions, so how do we get access to thinking about what's working, what's not working? And then there's constant resources in our member portal that have passive ways that you can learn about programming within ScreenU. So if you have questions like, I don't remember exactly how to do this, there's resources on how to do that. And so some broad questions of thinking about how we make ScreenU happen on campus. So why do we want to use ScreenU? Understanding from me is that it's not going to be a great fit at the current moment for every single person on this call. I absolutely understand that. And then so when thinking about why do we want to use it if we do, what's our goal? How do we make sure that we are successful? Because the last thing that I, as a professional, want to do is have someone get a tool and then not be able to use it and it just sit on a cloud shelf. And then so what do we want to do with it? How do we want to reach out to people? What are some of our barriers we anticipate? Do we anticipate admin or some of our colleagues? What are those barriers that we experience that are going to keep it on that shelf that we think about? Who are some of the partners that we want to do? So if you're really thinking about ScreenU might be an option, I would encourage you to jot down who are some of those partners that it might be. Is it the Fraternity and Sorority Life Office? I also understand those Fraternity and Sorority Life Office folks might be your barriers. We are often barriers to success on campus. I acknowledge that. So who are some of those key partners that are exactly? And then how can we measure success? So how do we know what we're doing is working? So here are other components. And then I saw a question. I know what Anthony's probably saying, wrap it up. Yes, so that is a great point. So utilizing ScreenU takes out the having to train folks in SBIRT. And then so there might be some still training about having conversations about what they have learned or what they've gone through in the ScreenU process. But with ScreenU, individuals don't have to go through the SBIRT process one-on-one with the students. They do everything that they would do in SBIRT in the ScreenU program in that 10 minutes. And so last thing for people to take away is that if we're thinking about supporting the foundation of the work that we do, screening in general, and opportunities for ScreenU, they give us the opportunity for universal and large-scale engagement. By having an opportunity to partner with so many people, it helps us support that wide foundation, right? We often hear the term silo in ScreenU, in higher ed, excuse me. And then so ScreenU gives the opportunity to how do we have a larger base and how we build up together and not individually. And it gives students supportive info through feedback, right? And so they get the feedback on their use. They can have that introspection and they can get those resources. Maybe they're not ready as soon as they take it to go to an office, but maybe they have that change and that stages of change theory. Maybe they get to that moment, but they know where those resources are. And then they know where to go because they went through ScreenU. That's a foundational opportunity that we have. And lastly, just knowing it's foundational, we know it is evidence-based because SBIRT is included in the college aim based on all of the research that had been compiled there. So as we wrap up, just some resources and next steps that we have here. Everyone say hello to David. That's you saw his picture. There he is coming home from, I guess, 5 days of kindergarten left. And then so that is all I have. Wanted to wrap up with cute pics of dogs because who doesn't love dogs? And so you may be super excited like Titus, either that it's Thursday and tomorrow's Friday, or that you're really excited about potential opportunities that you're seeing, or you're just contemplative and loving spring, early summer like Toby. But whether or not you're either one of these in the feeling vote, thank you for being with me this afternoon. Super excited that you took time of your afternoon to learn more about what we're doing at the center and hope to interact with you further. I'm going to be out of the office for a little bit, but we will reach out and have opportunities to follow up if you have questions. And again, following up, so if we think about membership, and so campus membership or highest level access to all three programs is $2,500. That's per year. And so that starts when we get things signed and payment complete. And then access to one program individually is $1,000. And then so let's say you wanted alcohol and cannabis, the total would be $2,000. So $2,500 for all three, $1,000 each. And then here's the breakdown of that. And then so I forgot we had this in there. Anthony just reminded me. And then so this is a breakdown of those membership levels and what you get for the membership piece. So that is all I have. Do want to highlight upcoming events that we have. The water cooler chat is going to be around problem gambling. I hope it's going to be a fantastic conversation. That free webinar on the 27th with Dr. Lang, I can guarantee you he's going to put the comprehensive in comprehensive. So hope you can join it from there, and then would love to see you in beautiful Columbus, Ohio for the national meeting. If being in Columbus in July and August is not in your bingo card, would love to see you attend our virtual conference as well. And all information about the national meeting can be found at atcaod.osu.edu. So that is all I have. Let me see if I can get to my very last page. But thank you again so much for being with us today. It has been my pleasure to be with you, and hope you have a fantastic rest of your day and weekend. And take care of yourself and take care of one another.